is about restless leg syndrome or RLS. Well, it's a condition that causes an uncontrollable urge to move your legs, usually because of an uncomfortable sensation. It typically happens in the evening or nighttime hours when you are sitting or lying down. Moving eases the unpleasant feeling temporarily. Restless leg syndrome, also known as Willis-Ekbom disease, can begin at any age and generally worsens as you age. It can disrupt sleep, which interferes with daily activities. Simple self-care steps and lifestyle changes may help relieve symptoms. Medication also helps many people with RLS. Earlier on this channel, I have already uploaded a short video about RLS. I hope you have already seen that video, and today I am going to present this illness in detail. Well, let me tell you the symptoms first. The chief symptom is an urge to move the legs. Commonly accompanying characteristics of RLS include sensation that begin after rest. The sensation typically begins after you have been lying down or sitting for an extended time, such as in a car, airplane, or movie theater. A relief with movement. The sensation of RLS lessens with movement such as stretching, jiggling your legs, pacing, or walking. Worsening of symptoms in the evening. Symptoms occur mainly at night. Nighttime leg twitching. RLS may be associated with another more common condition called periodic limb movement of sleep, which causes your legs to twitch and kick, possibly throughout the night while you sleep. People typically describe RLS symptoms as abnormal, unpleasant sensations in their legs or feet. They usually happen on both sides of the body. Less commonly, the sensation affects the arms. The sensation, which generally occur within the limb rather than on the skin, are described as crawling, creeping, pulling, throbbing, aching, itching, or electric. Sometimes the sensations are difficult to explain. People with RLS usually don't describe the condition as a muscle cramp or numbness. They do, however, consistently describe the desire to move their legs. It is common for symptoms to fluctuate in severity. Sometimes symptoms disappear for periods of time, then come back. Some people with RLS never seek medical attention because they worry they won't be taken seriously. But RLS can interfere with your sleep and cause daytime drowsiness and affect your quality of life. You should talk with your doctor if you think you may have RLS. Now let me tell you the causes. Often there is no known cause for RLS, idiopathic. Researchers suspect the condition may be caused by an imbalance of the brain chemical dopamine, which sends messages to control muscle movement. Hereditary. Sometimes RLS runs in families, especially if the condition starts before age 40. Researchers have identified sites on the chromosome where genes for RLS may be present. Pregnancy or abnormal hormonal changes may temporarily worsen RLS signs and symptoms. Some women get RLS for the first time during pregnancy, especially during their last trimester. However, symptoms usually disappear after delivery. Now I'll tell you the risk factors. Well, RLS can develop at any age, even during childhood. The disorder is more common with increasing age and more common in women than in men. RLS usually is not related to serious underlying medical problem. However, it sometimes accompanies other conditions such as peripheral neuropathy. Peripheral neuropathy is damage to the nerves in your hands and feet. It is sometimes due to chronic diseases such as diabetes and alcoholism. And then the next cause could be iron deficiency. Well, even without anemia, iron deficiency can cause or worsen RLS. If you have a history of bleeding from your stomach or bowels, experience heavy menstrual periods, or repeatedly donate blood, you may have iron deficiency. Another cause may be kidney failure. Well, if you have kidney failure, you may also have an iron deficiency, often with anemia. When kidneys do not function properly, iron stores in your blood can decrease. This and other changes in body chemistry may cause or worsen RLS. Spinal cord conditions. Lesions on the spinal cord as a result of damage or injury have been linked to RLS. Having had anesthesia to the spinal cord, such as a spinal block, also increases the risk of developing RLS. Now I'll tell you some complications. Although RLS does not lead to other serious conditions, symptoms can range from barely bothersome to incapacitating. Many people with RLS find it difficult to fall or stay asleep. Severe RLS can cause marked impairment in life quality and can result in depression. Insomnia may lead to excessive daytime drowsiness, but RLS may interfere with napping. Now I will tell you about the diagnosis of RLS. When patient come to us, we take your medical history properly and ask for a description of your symptom. A diagnosis of RLS is based on the criteria established by International Restless Leg Syndrome Study Group. Well, there are few points about the criteria for diagnosis of RLS which you should remember. The first thing is you have a strong, often irresistible urge to move your legs, usually accompanied by uncomfortable sensations. Your symptoms start or get worse when you are resting, such as sitting or lying down. Your symptoms are partially or temporarily relieved by activities such as walking or stretching. Your symptoms are worse at night. Symptoms cannot be explained solely by another medical or behavioral condition. Your doctor may conduct a physical and a neurological exam. Blood tests, particularly for iron deficiency, may be ordered to rule out other possible causes for your symptoms. In addition, your doctor may refer you to a sleep specialist. This may involve an overnight stay at a sleep clinic where doctors can study your sleep if another sleep disorder such as sleep apnea is suspected. However, a diagnosis of RLS usually does not require a sleep study. Now I will tell you a treatment for this condition. Well, sometimes treating an underlying condition such as iron deficiency greatly relieves symptoms of RLS. Correcting an iron deficiency may involve receiving iron supplementations orally or intravenously. However, take iron supplements only with medical supervision and after your doctor has checked your blood iron level. If you have RLS without an associated condition, treatment focuses on lifestyle changes. If those are not effective, your doctor might prescribe medications. Now I will tell you about some medications that are used for RLS. Well, several prescription medications, most of which were developed to treat other diseases, are available to reduce the restlessness in your legs. These medicines include medications that increase dopamine in the brain. These medications affect levels of the chemical messenger dopamine in your brain. Ropinirole, that comes with the name of Requip, rotigotine, that comes with the name of Nupro, and Pramipexole, that comes with the name of Mirapex, are approved by Food and Drug Administration, FDA, for the treatment of moderate to severe RLS. Short-term side effects of these medications are usually mild and include nausea, lightheadedness, and fatigue. However, they can also cause impulse control disorders such as compulsive gambling and daytime sleepiness. Other drugs that affect calcium channels can also be prescribed. Certain medications such as gabapentin, that come with the name of Neurontin, and gabapentin enacrabil, that come with the name of Horizont, and pregabalin, that come with the name of Lyrica, work for some people with RLS. Opioids. Well, narcotic medications can relieve mild to severe symptoms, but they may be addicting if used in high doses. Some examples include tramadol, codeine, oxycodone, that comes with the name of OxyContin. Okay. Then another group of drugs that can be used is muscle relaxant and sleep medication. Well, these drugs help you sleep better at night, but they do not eliminate the leg sensation and they may cause daytime drowsiness. These medications are generally only used if no other treatment provides relief. It may take several tries for you and your doctor to find the right medication or combination of medication that work best for you. Now I'll tell you some cautionary advice about some medications. Well, sometimes dopamine medications that have worked for a while to relieve your RLS become ineffective, or you notice your symptoms returning earlier in the day or involving your arms. This is called augmentation. Your doctor may substitute another medication to combat the problem. Most drugs prescribed to treat RLS are not recommended during pregnancy. Instead, your doctor may recommend self-care techniques to relieve symptoms. However, if the sensations are particularly bothersome during your last trimester, your doctor may approve the use of certain drugs. Some medications may worsen symptoms of RLS. These include some antidepressants, some antipsychotic medications, some anti-nausea drugs, and some cold and allergy medications. Your doctor may recommend that you avoid these drugs if possible. Or if you need to take these medications, you should talk to your doctor about adding drugs to help manage your RLS. Now I will tell you about some lifestyle and home remedies. Well, making simple lifestyle changes can help alleviate symptoms of RLS. These changes include: you should try baths and massages. Soaking in a warm bath and massaging your legs can relax your muscles. Apply warm or cool packs. Use of heat or cold or alternating use of the two may lessen your limb sensations. Establish good sleep hygiene. Fatigue tends to worsen symptoms of RLS, so it is important that you practice good sleep hygiene. Ideally, you have a cool, quiet, comfortable sleeping environment. Go to bed and rise at the same time daily and get at least 7 hours of sleep nightly. Exercise. Getting moderate regular exercise may relieve symptoms of RLS, but overdoing it or working out too late in the day may intensify symptoms. Avoid caffeine. Sometimes cutting back on caffeine may help restless legs. Try to avoid caffeine-containing products including chocolate, coffee, tea, and soft drinks for a few weeks to see if this helps. Consider using a foot wrap. A foot wrap, especially designed for people with RLS, puts pressure under your foot and may help relieve your symptoms. Well, this was my video about RLS. If you are suffering from RLS, please post your comment, and if you want me to upload a video about any other illness, for that video is already not there on this channel, please post your comment, and as soon as I get the time, I'll try to upload a video about that particular illness. Okay, thanks for watching this video. See you in next video. Bye for now.